All right, I'll convene us. Good morning, everybody. Thank you for joining us on this beautiful Boston day. Sandro Galea, for those who I don't know, I have the privilege of serving as Dean at the Boston University School of Public Health, and on behalf of the school, welcome to today's symposium. Before we begin, I want to thank the school's Center for Health Law, Ethics, and Human Rights for its leadership in making today's event happen, and I would like to thank Meredith Brown and Alicia Noel, whose work makes this event possible. Thank you. This year marks a century since the passage of the 19th Amendment to the United States Constitution. The amendment guarantees that the right to vote will not be denied or abridged on account of sex. This was not just a key moment for American society and politics, it was a key moment for health. Equity, inclusion, being able to fully engage in the political process, these are core to creating a world that generates health. This election year, with the primaries happening right now, it is especially important to explore how voting works at the heart of politics to shape the health of the public, and I very much look forward to doing so today. I'm going to turn the stage over to the intellectual architect of this symposium, our moderator, Professor Nicole Huberfeld, who will introduce our first keynote speaker and then moderate the rest of the day. Professor Huberfeld is Professor of Health Law, Ethics, and Human Rights at the School of Public Health and Professor of Law at the BU School of Law. Her scholarship focuses on the cross-section of healthcare law and constitutional law, with emphasis on the role of federalism and spending power in federal healthcare programs. She recently co-authored a new edition of the casebook Public Health Law, along with Professors Wendy Mariner, George Annis, and Michael Ulrich. Professor Huberfeld, the floor is yours.
Thank you, everyone. It's so exciting to be here today. I want to say welcome on behalf of BUSPH, welcome on behalf of the Center for Health Law, Ethics, and Human Rights. And also, I want to just suggest that the 19th Amendment might be the most important constitutional provision you never thought about. Why do I say that? Because when it was ratified on August 26th of 1920, it democratized 10 million voters, nearly 10 million anyway. So we might think that the Reconstruction era amendments, the 13th, 14th, and 15th Amendments, were the most important amendments to the United States Constitution because they freed slaves, made them citizens, and allowed them to vote. But in terms of pure numbers, the 19th Amendment was the biggest voting fell swoop in our history. Now, this democratic move only partially embodied the vision of first-wave feminists who had been working on this idea since before the Civil War. They sought nothing other than total emancipation from the control of men, because at the time it was quite common for intersectional subordination to exist in the fact that men were supposed to vote on behalf of those who could not speak for themselves. They voted on behalf of their wives, their children, their servants, their slaves, and even other men who weren't propertied. And so this great democratic republic started in a place that wasn't very democratic at all. And so few perceived then or now that the vote was enough. And the framers of the 19th Amendment actually started on the Equal Rights Amendment in 1923, knowing that the vote wasn't quite enough. At the 50-year anniversary of the 19th Amendment, second-wave feminists still sought family equality, control over childbearing and child rearing, and equal pay for equal work. Now, at 100, we're having the same kinds of conversations. And so I think it's worth understanding that the Equal Rights Amendment was just ratified by Virginia. And I hope that's something that we can talk about later in our conversation today. So what does the vote mean, and why does it matter? The relationship between health and voting is well established in the literature. We know that people who are healthy are more likely to vote. We also know that voting itself is a feature of being socially connected. It improves mental health, and it makes people feel more connected to their community in general. So we know that voting works in both directions. We also know that health is more than genes, right? All that we talk about these days is social determinants of health. We understand that it's social and political. So what does the vote mean? It's nothing less than disestablishment of gender hierarchies. When we talk about the vote for women, what we're talking about is total political, civic, and social equality. And that's what our conversation will cover today. We have three incredible speakers who are joining us today. First, we'll have Dr. Rachel Levine. She's currently the Secretary of Health for the Commonwealth of Pennsylvania and a professor of pediatrics and psychiatry at Penn State College of Medicine. Dr. Levine is a fellow of the American Academy of Pediatrics, the Society for Adolescent Health and Medicine, and the Academy for Eating Disorders. Dr. Levine is the president-elect of ASTHO, the Association of State and Territorial Health Officials. She's also an executive board member of ASTHO. Dr. Levine joined the Wolf administration in January of 2015 as the Physician General of the Commonwealth of Pennsylvania and served from 2015 to 2017. She was named Acting Secretary of Health in July 2017 and confirmed in March 2018. Her previous posts included Vice Chair for Clinical Affairs for the Department of Pediatrics and the Chief of the Division of Adolescent Medicine and Eating Disorders at Penn State Hershey Medical Center. In addition to her recent post, Dr. Levine is also an accomplished regional and international speaker, author on the opioid crisis, medical marijuana, adolescent medicine, eating disorders, and LGBT medicine. Dr. Levine graduated from Harvard College and Tulane University School of Medicine and completed her training in pediatrics and adolescent medicine at Mount Sinai Medical Center in New York City. After Dr. Levine, we'll hear from Dariely Rodriguez, who is the director of the Economic Justice Project at the Lawyers Committee for Civil Rights Under Law, where she leads the committee's efforts to combine discrimination in employment, healthcare, including reproductive services, and economic opportunities on behalf of communities of color, including women and LGBTQ individuals. In this capacity, she serves as plaintiff side counsel in various impact litigation matters. Dariely has co-authored or otherwise significantly contributed to amicus briefs before the Supreme Court, including in June Medical Services versus G, which is the case that the court will hear at the beginning of March regarding what it means for a state to regulate in the name of health when it's trying to limit access to abortion. Comcast versus National Association of African American Owned Media, Masterpiece Cake Shop, and Bostock versus Clayton County, and other federal courts. Dariely is co-chair of the Employment Task Force of the Leadership Conference on Civil and Human Rights, the National Umbrella Organization of American Civil Rights Groups. Before joining the Lawyers Committee, Ms. Rodriguez worked as an Assistant Attorney General in the Civil Rights Bureau of the New York State Attorney General's Office. There, she prosecuted affirmative civil rights cases in the areas of disability access, immigration services fraud, consumer racial profiling, language access, employment discrimination, and reproductive rights. Prior to joining the New York State Attorney General's office, Ms. Rodriguez worked in private practice for several years as an employment attorney. She began her career clerking in the New Jersey Superior Court Civil Division and received her JD from Hofstra Law School, where she was a Lat Crit Scholar and recipient of the Dwight L. Green Full Tuition Scholarship for Minority Rights Advocacy. Her BA is from New York University. Last, but certainly not least, we will hear from Susannah Wellford. Susannah Wellford is the CEO and founder of Running Start. Over the last 2 decades, Ms. Wellford founded 2 organizations designed to raise the political voice of women in America. In spring 2007, Susannah founded Running Start to inspire young women and girls to pursue political leadership. Running Start furthers the work begun by Women Under 40 Political Action Committee, which Susannah co-founded in 1999 and led for 5 years. Susannah speaks frequently around the country about the importance of involving young women in politics. She has also lectured about politics to international groups from dozens of countries. She was invited to Kuwait by their government in spring 2006 to meet Kuwait's first women candidates and to advise them on their campaigns, and has been sent by the State Department to speak in the Maldives, Sri Lanka, Israel, Belgium, Ukraine, Algeria, and Russia. Susannah was recently selected to participate in the Joint Civilian Orientation Course, the oldest and most prestigious public liaison program in the United States Department of Defense. After receiving her JD from UVA School of Law, Susannah worked for several years at Werner, Lilfert, Bernhard, McPherson, and Hand, lobbying for state and local governments, foreign governments, corporate entities, and trade associations before Congress and the executive branch. Prior to law school, Susannah worked for Hillary Clinton's healthcare task force in the Clinton White House. So, without further ado, it's my pleasure to welcome Dr. Levine. Thank you.
Good morning. Thank you very much. It's a pleasure to be here. Thank you for inviting me. So I'm the physician in the panel of lawyers, but I do have to admit that I come from a family of attorneys, many of whom were trained at BU. My mother, my father, my uncle, my sister, my cousin, my niece, and my son are attorneys. So I'm clearly the black sheep of the family by going on to medical school, but I feel very comfortable in a lecture hall filled with attorneys. So I have no actual or potential conflicts of interest. I have no financial conflict of interest. We have 2 children who just graduated from college and now are either in or headed to graduate school, and I'm a public official, so I have no financial interest whatsoever. So we don't have to worry about that. I'm going to talk about LGBTQ health disparities and voting issues, et cetera. But I always like to kind of set the stage when I talk about LGBTQ issues. So let's talk about some terms. So if I say LGBT, people usually know what I mean: lesbian, gay, bisexual, and transgender. But if I say LGBTQIAP+, many people get lost in the alphabet soup. So let's review that. LGBT is indeed lesbian, gay, bisexual, and transgender. Q, the first Q would be questioning. That would be individuals who might question their sexual orientation or their gender identity. The second Q is queer. Now, people of my age, old people, tend to shudder when they hear the term queer, because queer in the past was a very negative, derogatory term. But now it has been reclaimed by the LGBTQ community, and many young people, actually, when asked how they define in this space, will very proudly announce that they are queer. So we have reclaimed that word. I are individuals that are intersex. Those are individuals who have medically a condition called the disorder of sexual development or disorder of sexual differentiation, a hormonal condition, a genetic chromosomal condition where they are intersex, and often would require some type of medical intervention because of medical complications. The first A would be individuals that say that they are asexual or agender, that they do not identify as having a sexual orientation or a gender identity. And the second A are allies, and we are very, very grateful for the support of allies. So they're those who are not on the rainbow, so to speak, but identify with and support the community. P can be pansexual, pangender, polysexual, polygender, and I am actually just scratching the surface of how people identify in this space. Many, many more terms that we could talk about. So you can see how diverse the community is. Your gender roles are how you might identify in this space in terms of your family or your community, typically associated with gender. And we have obviously very different gender roles than we had many 50, 75 years ago. And the best example I have that is my very dear 95-year-old mother. My mother was the only graduating female law student at Boston University School of Law in 1946. My mother graduated law school in 1946 when women didn't become lawyers, they didn't become doctors, and obviously that has changed, at least in our culture, over the last 75 years. Your sexual orientation is who you want to be with, who you want to have a relationship with, an intimate relationship with, who you might want to be close to in that intimate way. Your gender identity and expression is how you identify inside, traditionally male or female, and then how you want to express that to society. A very important point is that there is no overlap between sexual orientation and gender identity, and so don't assume that overlap. They are separate concepts, and it's important to understand them separately. So for instance, you might be someone who was assigned male at birth that transitions to female, a transgender girl or woman that is attracted to men or women or both or neither, and same for a transgender man. So let's talk about some more terms. So transgender is that you do not identify with the sex that you were assigned at birth. Cisgender is that you do identify very well with the sex that you were identified at birth. You can have male to female transgender individuals, that would be a transgender girl or woman, or female to male, transgender boy or man, and it's about 50-50. That gets quoted often wrong in the media, but it's about 50-50. Now, that is assuming a binary of male or female. But what I have to tell you is that in the brave new world of gender, particularly among young people, is they do not accept that binary of male and female. And they'll be anywhere on these spectrums that they want at any time. And so other terms that have entered the lexicon include genderqueer, gender fluid, gender non-binary, gender non-conforming, gender fluid, gender expansive, and many other terms. Now, I understand that for most people, again, you might be cisgender, so you identify with the sex that you were assigned at birth. You might question many things in your life. You might question your family. You might question your profession. You might question your school, not Boston University, but some other school. You might question those things, but you don't question your gender. It is a fixed star in your universe, but not if you're transgender. And so if you do or do not know my background, I am an openly transgender woman. And so it had never seemed right for me. And as we talked about at dinner, I grew up in the greater Boston area, and I went to the Belmont Hill School. If you know the Belmont Hill School, it's a very nice all-male prep school right there in Belmont, which was an interesting experience we can talk about sometime if you want. But never felt comfortable for me. And so for about 99.7% of the world, you feel very comfortable with the gender you were assigned at birth, but not for the 0.3 or so percent of us that are transgender. And that's not even including the gender non-binary community. There is a field of transgender medicine, so of course there is a diagnosis. We are in the DSM. How many people are familiar with the DSM? The Diagnostic and Statistical Manual of Mental Disorders. Say that 3 times real fast. In DSM-5, it was changed from gender identity disorder to gender dysphoria, with the idea that it's not a disorder in itself. Personally, I think that this is a stepwise process until DSM-6, and maybe some of you or some people in this building write DSM-6, and it'll come out of the DSM altogether. You have to remember that being gay, lesbian, or bisexual was a mental disorder until the mid-70s. There is an association, the World Professional Association for Transgender Health. It has guidelines. There's a new revision coming about the evaluation and treatment of quote-unquote transsexual patients. We don't tend to use that term much anymore, including a psychological evaluation, medical evaluation, and treatment. There is a medical standard of care from this journal, the Endocrine Treatment of Gender Dysphoric, Gender Incongruent Persons from the Endocrine Society a couple of years ago, which for physicians and therapists and stuff basically provides a standard of how to evaluate and treat people who want treatment for being transgender. Challenges for the future of this field, training programs for psychological, medical, and surgical evaluation and treatment, new treatment guidelines, especially for gender non-binary individuals, and improved reproductive options. So lots of room for growth in this field. I want to switch gear and talk about some health disparities. Sexual and gender minorities, you'll hear that term used a lot, sexual and gender minorities are at increase of significant negative health outcomes, an increased risk of substance abuse, increased risk of depression, anxiety, increased suicidality. But it is nothing inherent with being LGBTQ, which would predispose us to those type of negative health outcomes. It is the bullying, it is the harassment, it is discrimination and victimization that LGBTQ individuals face, which lead to those negative health outcomes. And not only that, but for sexual and gender minorities, particularly transgender individuals of color, and particularly transgender women of color, are at risk of not just harassment, but violence and murder. And so we have to consider those health equity issues in thinking about the LGBTQ community. For example, this article from the journal Pediatrics in 2019 about school restroom policies. So that sexual assault is prevalent in the transgender community, in the non-binary youth community, but restrictive bathroom policies actually make that much worse. So actually in Pennsylvania, we did a 2018 LGBT health needs assessment. And that showed that, in the population, that it answered the assessment. 38% identified as gay, 24% as lesbian, 21% as bisexual, 85.7% identifying as gay have been tested for HIV, but 14% had never been tested. LGBT persons actually were less likely to smoke than transgender individuals, but more likely to smoke than the general population. It's interesting. I think some of that is because of stress and smoking for stress, but some of it is that the LGBT community has been targeted by tobacco companies. Tobacco companies have very kindly sponsored many pride festivals. Now, you and I know that's because of the beneficence of tobacco companies who are known for their public outreach in this regard. Actually, it's because they want to sell more cigarettes to LGBTQ people. But so there are many pride festivals now will actually refuse donations from tobacco companies. 291 out of the group identified as trans. 3 out of 4 transgender and gender nonconforming respondents feared a negative reaction by a healthcare provider. Much more smoking in the population, meant significant rates of mental health issues, and actually 41% of the trans population had never been tested for HIV, lack of access to healthcare. 30%, this is in Pennsylvania, have been either fired, denied a promotion, or experienced mistreatment in the workplace. 23% had had housing discrimination. 46% were verbally harassed, but the vast majority were interested in healthy living strategies. Another study, the 2015 U.S. Transgender Survey from the National Center for Transgender Equality in Washington. A third had had a negative reaction from their healthcare provider. 40% nationwide of trans individuals had attempted suicide. 40%. HIV was 5 times more common, but if you remember, less tested. And most had had transition-related coverage denied. 57% would be uncomfortable talking to the police. 30% had had job issues. Actually, that's a repeat of the same slide. Sorry, I think I went backwards. National Survey on LGBTQ youth mental health. This is for LGBTQ youth. 2 out of 3 had had someone try to convince them to change their gender identity. 71% had discrimination. 50%, 8% of trans and non-binary youth had bathroom issues. 54% had considered suicide, and 29% had attempted suicide. So you live here in Massachusetts, which has a very comprehensive non-discrimination law, although it was just extended to trans individuals a couple of years ago. But in Pennsylvania, there is no statewide anti-discrimination law. There is in Philly, there is in Pittsburgh, and other municipalities. That includes protections for employment, housing, and public accommodations. So not only for trans individuals, but for LGB individuals, you can get married because of marriage equality, put your wedding picture on your desk, and then get fired. I could leave, at the end of this term, being Secretary of Health, go to get a physician's job in most places of Pennsylvania, and they could say, Dr. Levine, you did a great job. Thank you so much for working on the opioid crisis. No, but I won't hire you because you're trans. Or I will not sell you this house or rent you this apartment because you're trans, in most places of Pennsylvania. Nationally, there has been the Federal Equality Act, which successfully passed the House of Representatives, comprehensive non-discrimination in regards to sexual orientation and gender identity and expression, and not surprisingly did not get very far in the Senate. There are lots of challenges in our current federal government. The transgender military policy has been one challenge. Withdrawal of Title IX protections for LGBTQ students in schools. These are previous Title IX protections from the previous administration. A proposed policy to allow homeless shelters and federally funded housing facilities to refuse treatment to trans individuals, for instance, in the middle of a Boston winter. Health and Human Services has issued a rule that excuses healthcare providers from participating in or for insurance companies to pay for medical services on religious or moral grounds. I will not see you, Dr. Levine, for this broken arm because you're trans and I just don't treat trans individuals because it's against my religion. Concerns that will encourage healthcare workers to deny medical treatment for LGBTQ individuals because of personal religious or moral beliefs, and a policy rollback about no longer recognizing gender identity or sexual orientation as part of the definition of sex in civil rights protections. In terms of Title VII of 1964 Civil Rights Act, there is actually a Supreme Court case right now. I believe arguments were heard in October on whether the Civil Rights Act prohibits sex discrimination and protects LGBTQ individuals from workplace discrimination based on sexual orientation or gender identity. So we'll see how the Supreme Court comes down probably in June. Is that correct? So in terms of voting, I want to highlight a study done by the Williams Institute at UCLA in California. There are nearly 9 million LGBT, they didn't really use the term Q, so this will be just LGBT. LGBT adults are registered to vote. Almost half are under age 35, so it's a young group. A third have at least a college education. I don't know if you can see this, but it is the group of millennials is much higher, 8.2%, where for Gen X, boomers, et cetera, it's really down here. So this is a young group in terms of LGBT voters. They are racially diverse, at least more racially diverse than non-LGBTQ voters. But 21% are not registered to vote. So LGBT voters, oops, let's go back. 47% are 18 to 34. Only 20% of LGBT voters are 55 and older. The majorities of both LGBT voters and non-voters actually said that in this study that race and sexual orientation would not influence their vote. But if it did influence their vote, the LGBT voters were significantly more likely than non-LGBT voters to say that they would support a racially diverse candidate or an LGBT candidate. Does that make sense? Yeah. Linked to health outcomes and linked to income. So 6.2% have less than $36,000 of annual household income. So LGBT identification is more common among those with lower incomes, and we know that poverty is a significant risk factor for negative health outcomes. And so it links together from that point of view. More voting challenges. A third of transgender individuals have not updated their government ID. And so it isn't that easy, and trust me on this one, it isn't that easy to change your gender. Right? It's not that easy to change your gender, and it's not that easy to legally change your gender. And there are many states, some states where it's easier and less easy. In Pennsylvania, as we'll talk about, we have made some progress in terms of this, but in Massachusetts you have, but in other states, particularly in the South, you either cannot change your gender or it's very, very difficult to change your gender. And even if you haven't changed your gender and your name on your ID, then you're not going to look like your name. So you're not going to be, your picture won't be consistent. So if you have strict ID laws, then that's going to be an issue. It's also, there's significant costs to updating it. In some states, you have to hire a lawyer and pay a lawyer to change your name and to change your gender for your ID if it's even possible. And that means having an income enough to be able to hire a lawyer to do that. And we just talked about that low income. So there are 137,000 trans people eligible to vote in the 2018 elections in the study quoted down here. But more than half may not have their documentation and ID that is consistent with their appearance in terms of their gender, which will lead to great difficulties if you have to have your ID for gender. So lots of concerns in terms of that. So voting matters. I don't have to tell you that here and today after the election last night. So this is Governor Wolf right here, who I am, the biggest ally of our community that we could possibly have, and I'm very proud and privileged to serve in his administration. At the beginning of the administration, we started an LGBT work group, a policy work group. We have the alphabet soup of agencies. You learn a lot of acronyms in state government. So that's the Department of Health, Human Services, Aging, Administration, Education, Military Veterans Affairs, Corrections, Pennsylvania State Police, other agencies, stakeholder groups that formed a policy work group that has been continuing now for 4 to 5 years about LGBTQ policies, while we continue to advocate for equality, non-discrimination legislation in Pennsylvania. We have upgraded the policy to change their birth certificate. In the past, to change your birth certificate, you had to have surgery. Well, most transgender individuals actually don't have surgery for lots of reasons, including insurance won't cover it, and it can cost $25,000 in cash. So If you had to have surgery to change your gender, then you can't change your gender. Medicaid in Pennsylvania will cover gender confirmation treatment, as will CHIP, Children's Health Insurance Program. We have worked with the Department of Education for trans, LGBTQ, and trans students. That was under the new Title IX guidance, which has been repealed, so we're trying to kind of counteract that. We have worked with the Department of Corrections in terms of their PREA, rape prevention policy, to protect trans inmates. Very challenging work. I know that it has been a big challenge here in Massachusetts. There was a big court case, I believe, here in Massachusetts about this. So big challenges for LGBTQ individuals, and particularly trans individuals in corrections. Corrections, almost by definition, is a tremendously gendered environment. Lots of concerns about safety, and so it's a real challenge. But we have a work group with corrections where we work to try to, when appropriate, transfer individuals to the institution consistent with their gender identity. We have worked with the Office of Administration for policies within the administration to protect LGBTQ employees. And we actually changed birth certificates. The birth certificates used to say mother, father. We were able to change that to parent, parent. And actually, with our new system, you're going to have a drop-down box, and you can have it say anything you want. So you can have parent, parent, mother, father, mother, mother, father, father. Any combination that you want, you'll be able to choose with our new information system, which makes then everybody happy. Now, we did have an election code bill, which passed in 2019, signed by the governor, which made some progress, although it's not total non-discrimination. No excuse mail-in voting for the first time in Pennsylvania, 50-day mail-in voting period, a permanent mail-in ballot list, 15 more days to register to vote, and it extends the mail-in and absentee submission deadline. So in Pennsylvania, with a very progressive governor and a much less progressive legislature, that was the most we could get in a bipartisan way, but it really was tremendous progress. And Governor Wolf has started the first state commission on LGBTQ affairs. So we have about a 50-person commission. We have an executive director of the commission to be able to advocate for LGBTQ individuals in terms of policy and in terms of other issues throughout the state, to work with us in the agencies, to lead the policy work group now, and to lead the commission. So that has been a tremendous advance for LGBTQ individuals in Pennsylvania. So I thought I would take the whole 30 minutes, but I have 5 minutes left. So that is my Twitter handle, and I don't tweet as much as some people do, although I don't actually even do my own how to do Twitter. I'm just really old, and so my staff do Twitter. I'm sure we'll be tweeting about me here, but that's my Twitter handle, @Secretary Levine. Thank you very much for your attention. And I know we have questions at the end, but I have 5 minutes. So does anybody have any questions? Yeah?
Yeah, I have a question. So how would you advise a transgender person who desperately wants to vote in Pennsylvania but is worried that they're going to be turned away at the polls? I mean, is the mail-in option a good option?
That might be a really good option, is to do absentee voting. It really depends where they live. So again, it is easier to change your gender marker in Pennsylvania. We made it easier. So it really requires just a letter from your therapist or doctor to change your birth certificate and to change your driver's license. So it isn't as hard as it is in other states. To change your name is still a challenge. I mean, you have to go to the prothonotary, you have to get fingerprinted. You don't actually have to hire a lawyer, but some counties are making people hire lawyers, which I think is not quite fair. But it does cost money, and it takes time. So I think, if you're in Philadelphia, or if you're in Pittsburgh, if you're even in Harrisburg, you'll probably be fine. If you're in other rural areas of Western Pennsylvania, maybe to vote by ballot, absentee ballot, and to mail it in. There are a number of attorneys, I know particularly in Pittsburgh, that have, quote unquote, the name change project, where they will help trans individuals with changing their name and their gender marker for free, pro bono. So there's a whole group of attorneys, so I believe it's called the Name Change Project in Pittsburgh to help that. So that's that's particularly helpful to help trans individuals. But again, you know, trans individuals are a particularly at-risk group in terms of employment, and there's more unemployment, there's more very, you know, low employment, even if you've had higher education. And so having, you know, it's a real challenge, I mean, for even the money to change your name if you're underemployed. Yeah. Other questions? Yes?
Is Pennsylvania leading the way in reforms?
I think that, no. In terms of LGBTQ individuals, we are not leading the way. I think the governor would lead the way. We would lead the way. I think the legislature is challenging. For instance, I have a hearing coming up in March because they had a bill a year or so ago to deny Medicaid and CHIP from covering trans affirmative treatment for kids under 18, including therapy and medical care. So there's a hearing about that. That was defeated, but there's a hearing about that in March where I'll be testifying about why I think trans kids should be able to get, you know, have treatment such as there's whole protocols for trans kids in terms of counseling and medicine, medical evaluation, and why that should be covered by Medicaid and CHIP. So I would say that the governor would lead the way, but Pennsylvania is not leading the way. I think that there are some New England states that have led the way, and I think that in the Northeast and in the West have led the way. Well, thank you very much.
Thank you again, Dr. Levine. Now we'll hear from Dariely Rodriguez. After her talk, we'll take a brief break, and then we'll hear from Susannah Wellford.
Good morning, everyone. First, I would like to thank Dean Galea for hosting this important summit and inviting the Lawyers Committee for Civil Rights Under Law to participate. I want to recognize my boss, Kristen Clark, who could not be here today and asked me to come on her behalf. For those of you who don't know her, Kristen is a fearless trailblazer who has dedicated her professional life to advancing civil rights, and in particular, voting rights. I am not a voting rights expert, but I have learned a lot from watching Kristen in action. I've had the distinct pleasure of working for Kristen now since 2012, both at the New York Attorney General's office and now at the Lawyers Committee. Kristen was recently named one of 5 modern-day voting rights heroes by News One, so it's appropriate to recognize her tireless work as we celebrate the 100th anniversary of the 19th Amendment. So I'm very excited to be here because I am originally from Boston. I was born and raised here, not too far from here in Brighton, to an Afro-Puerto Rican mother and a Dominican dad who migrated here in search of better economic opportunities. Both of my parents were public school teachers and instilled in me from very early on a deep sense of activism and justice. In the mid-1980s, my family moved to a house in Hyde Park. Anybody here from Hyde Park? Yeah, great. Which at the time was a white working class neighborhood. We were the first family of color in our neighborhood, and that experience left an indelible mark on me. I attended Boston Latin School, not too far from here, and my experience there as an Afro-Latina also deeply impacted me. I was a sophomore there when the racial quota system was abolished, resulting in a great decrease in the number of students of color in incoming classes. These racial disparities frustrated me because I firmly believed that a public school in the middle of Boston should reflect the city's demographics. I had no attorneys in my family, unlike Dr. Levine, but these experiences while growing up in Boston instilled in me a great desire to advocate for social and racial justice. So I was admitted to BU for undergrad, But to my mother's chagrin, I decided to go to NYU, which was a phenomenal experience. I'm sure BU would have been a great experience too. When I was at NYU, I initially thought that I would pursue a master's in social work because I really had a strong desire to help people. And it never once crossed my mind that I should and could explore a career in civil rights. It didn't cross my mind until, I think, junior year. I was having a conversation with my mother, and she asked me, "What are you doing after you graduate? What are you going to do for money?" And I said, "Well, I think I'm going to get my master in social work." She had already dissuaded me long ago from becoming a public school teacher. So she said, well, you should really rethink that. I don't know what the earning capacity is for social workers. Why don't you think about law?" And I said, "Really? I don't know a single attorney." And law school just seemed so out of sight. It didn't seem within reach. And I was very lucky to have two college professors, one African American, one Latina, who were both social justice advocates. And they knew that I had a passion for social justice and civil rights. They encouraged me to go to law school. They were very frank with me. They said, "Law school will be difficult. You will learn a new way of thinking. It will be very difficult for you to push for progress once you're out in the real world, but you should absolutely explore the opportunity." And so I did, and I was incredibly lucky to get a full ride to Hofstra Law School. Economics was an issue. Without that full ride, I would not have been able to go to law school. Without that full ride, I would not be here today. After graduating from law school, I took a detour in private practice for several years, was able to pay off some debt, and then I landed my dream job as a civil rights attorney. And currently, I am incredibly privileged to practice law at the Lawyers Committee as its Economic Justice Project Director. So a little bit about the Lawyers Committee. We are a national, nonpartisan organization based in DC. We are a multifaceted civil rights organization that works to advance racial justice, strengthen democracy, and address economic inequality in the US by tackling drivers of poverty and promoting the rule of law. We believe that in order to strengthen our democracy, we must ensure that all Americans can enjoy access to the ballot box, regardless of race. Our work is driven by the belief that our democracy is strengthened when all Americans enjoy access to racially just and equitable systems. Today, I will discuss the suffrage movement within the context of the civil rights movement, the barriers that continue to face African American voters, and the work that the Lawyers Committee is doing to advance racial justice. So we're here today to mark the upcoming centennial anniversary of the ratification of the 19th Amendment. However, the 19th Amendment did not give all women the right to vote in reality, and the rights of Black men and women to this day are still under attack. We must reflect on the centennial through an honest and thoughtful lens that takes into account our country's very ugly history of structural racism. A central tenet of my work at the Lawyers Committee and of my team is intersectionality, a term coined by Kimberly Crenshaw in 1989. Professor Crenshaw argued that equal justice requires the recognition that people living at the intersection of multiple forms of oppression, such as race and gender, face cumulative and distinct harms that the law must recognize. I remember being a student at NYU learning about intersectionality, and I was thrilled. I was thrilled because finally I had the language to explain the experiences that I had experienced as a woman of color. What I've learned as a civil rights attorney, however, is that Black women have been exercising the principles of intersectionality in their work to fight for justice long before Crenshaw even coined the term. Civil rights activists like Fannie Lou Hamer and Pauli Murray fought courageously to ensure that our civil rights laws recognized their true selves and the experiences that they faced as Black women. The suffrage movement was diverse, it was not monolithic, and it was painfully complicated. While August 18, 1920, the date that the 19th Amendment was ratified marked a huge victory for democracy. That victory was not shared by all women equally. Black women, in particular those who lived in southern states, had to wait decades more until the passage of the Voting Rights Act in 1965 before discriminatory voting laws were outlawed. For many reasons, Black women did not have the luxury of being able to only focus on suffrage. They recognized that even though sexism was a legal barrier to voting, entrenched racism was as well, and that it was impossible to separate the two. In addition to fighting for the right to vote, Black women were also concerned with abolition, with racial violence, with lynching, forced sterilization, and later on, the brutal segregation of Jim Crow, and a lack of access to adequate housing, education, and work. At the height of the Civil War in 1860, nearly 90% of the African American population, about 3.9 million people, lived in the Confederacy as slaves. In 1865, Congress abolished slavery. And after slavery was abolished, Congress passed the 15th Amendment, granting certain Black men the right to vote. But as we know, this right was short-lived, as states refused to extend emancipated African Americans full benefits and equality under the law. According to W.E. Du Bois, after slavery was abolished, the slave went free, stood a brief moment in the sun, and then moved back again towards slavery. Southern states found ways to circumvent the intent and protections of post-Civil War amendments establishing rights for African Americans, including the 15th Amendment. The vestiges of slavery persisted in the decades after the Civil War. In 1896, the Supreme Court upheld the constitutionality of segregation in Plessy versus Ferguson. After Plessy, Jim Crow laws enacted in the late 19th and early 20th centuries relegated them to second-class citizenship. Southern states stripped Black men of their political rights by imposing racially discriminatory poll taxes and literacy tests designed to prevent them from voting. Many anti-suffragists were concerned about giving Black women the right to vote because they believed that they would use their right to challenge Jim Crow laws. White women realized that the only way to get the 19th Amendment ratified, in Southern states in particular, was to exclude the rights of Black women. Despite encountering racism in the women's rights movement, countless courageous Black women played a central role in the suffrage movement and later on in the civil rights movement. Their narratives, though, are often forgotten. I will highlight three whose stories really speak to me, but there are so many more, as you can imagine, who really sacrificed a lot for the movement. First, in the late 1800s, abolitionist Frances Ellen Watkins Harper, a Black woman who was a teacher and a poet, advocated for universal suffrage, regardless of race or sex, and opposed the fact that the 15th Amendment only granted Black men the right to vote. Some suffragists expressed, like Elizabeth Cady Stanton, expressed grave concerns that educated white women would become political subordinates to recently emancipated Black men. Before Congress passed the 15th Amendment, Frances Harper famously said, "We are all bound up in one great bundle of humanity, and society cannot trample on the weakest and feeblest of its members without receiving the curse of its own soul." Second, Amelia Boynton Robinson was born in Savannah, Georgia, and was 10 years old when the 19th Amendment was ratified. From a young age, she encouraged Black women to vote, despite the grave risks that came with casting a ballot while Black. She graduated from Tuskegee and worked in Selma, Alabama, where less than 1% of the city's voters were Black as a result of discriminatory poll taxes, literacy tests, and other intimidating tactics designed to disenfranchise Black voters. She and her husband organized and operated voter registration clinics for Blacks and testified before the Federal Civil Rights Commission on the often deadly barriers faced by Blacks trying to exercise their right to vote. In 1964, she was the first Black woman to run for a congressional seat in Alabama, and in 1965, she played a pivotal role in organizing the march in Selma, during which she was viciously attacked by law enforcement and somehow managed to survive. 5 months later, after the attack in Selma, she witnessed the signing of the Voting Rights Act. And then finally, Fannie Lou Hamer was born to sharecroppers in Montgomery County, Mississippi in 1917, and she left school at the age of 12 to work on the field with her parents. In 1961, she became active in civil rights after she was forcibly sterilized while undergoing a surgery to remove a uterine tumor. In 1962, she took 17 volunteers to register to vote in Indianola, Mississippi, but she was denied the right to vote because she failed a literacy test. She worked tirelessly to shed light on the barriers African Americans faced in accessing the right to vote. So it's February, and less than a month away, in March 7th, we will mark the 55th anniversary of Bloody Sunday, when civil rights advocates, including Martin Luther King Jr. and John Lewis, set out to march from Selma to Montgomery, Alabama. The marchers did not get very far before state troopers attacked them. The brutal scene was recorded and aired on television, enraging Americans and motivating civil rights and religious leaders to join the protest in Selma. Bloody Sunday and the resulting protests mobilized Congress to pass the Voting Rights Act, which was signed by President Johnson in August of 1965. The Voting Rights Act outlawed the use of discriminatory practices like literacy tests. Section 2 of the Voting Rights Act prohibits voting practices or procedures that discriminate on the basis of race, color, or membership in one of the language membership in one of the language minority groups. Section 5 of the Act contains special enforcement provisions targeted at those areas of the country where Congress believed the potential for discrimination to be the greatest. Under Section 5, jurisdictions covered by these special provisions, including in many southern states, could not implement any change affecting voting until the Attorney General or a federal court determined that the change did not have a discriminatory purpose and would not have a discriminatory effect. So, while the Voting Rights Act was a significant achievement, there is still much work to be done, and I think that that is the theme of the day. Voter suppression remains a serious challenge in the United States, largely impacting African Americans as well as other historically marginalized populations like Native Americans and Latinos. Voter registration restrictions, strict photo ID requirements, and gerrymandering are just a few measures that have prevented people of color from fully participating in the electoral process. Marginalized communities are particularly vulnerable since the 2013 Supreme Court holding in the Shelby County versus Holder decision, which weakened Section 5 of the Voting Rights Act. Chief Justice Roberts, writing for the majority, justified the majority's ruling by claiming that things have changed dramatically in the South since passage of the Voting Rights Act, and that blatant discriminatory evasions of federal decrees are rare. Writing for the dissent, Justice Ginsburg, however, argued that Congress passed the Voting Rights Act because requiring private individuals and civil rights groups, like the Lawyers Committee, she didn't say the Lawyers Committee, but to litigate every threat to voting rights was ineffective and extremely expensive, because every time that a discriminatory law or a practice was struck down, another slightly different one would take its place, and that is what we are seeing. In October of last year, our executive director, Kristen Clark, testified before Congress in a hearing on voting rights and election administration and challenged the fallacy of Justice Roberts' claim. In her testimony, she noted that the Shelby County decision has opened the floodgates to discrimination. While we no longer have literacy tests or direct poll taxes of decades past, modern voter discrimination is subtler, but just as pernicious. Kristen noted that our country is currently experiencing a period of retrenchment concerning access to the franchise, with rollbacks of firmly established voting rights around the country. Since Shelby County, the Lawyers Committee has been involved in 41 cases relating to discriminatory practices in voting. 24 of these cases have been filed since January 2017, which is 24 more than the cases brought by the current administration's Department of Justice. While we have achieved substantial success in many of these cases, it's likely that this is just the tip of the iceberg of potential violations or discrimination facing voters of color. She closed her remarks by calling on Congress to restore the full protections of the Voting Rights Act so that all voters may have an equal opportunity to cast a vote and fully participate in our democracy. As we head into the presidential elections, our voting rights team is hard at work. We are coordinating with partners on the ground and have deployed volunteers and organizers throughout the country to monitor potential barriers to the ballot box, and we stand ready to challenge these barriers through litigation. And that's just the work we're doing on the voting rights front. Beyond voting, we're also working to protect affirmative action in higher education, to challenge racial disparities in our criminal justice system resulting from mass incarceration, and to fight segregation in housing. And what about the project that I lead, the Economic Justice Project? I draw my inspiration from Fannie Lou Hamer, from Frances Harper, and Amelia Boynton by being very intentional about focusing on the intersection of race and gender and centering the narratives of Black women and LGBTQ people of color in the briefs that we file with the Supreme Court and in the policy advocacy in which we engage. These are populations, as Dr. Levine so eloquently mentioned, are continuing to experiencing severe discrimination, disproportionately high rates of poverty. We are seeing increased attacks on the right to abortion, the right to healthcare access, the right to contraception, and unemployment always falls hardest on these groups. Now, abortion, contraception, healthcare access, these are not issues that civil rights organizations have traditionally considered to be civil rights issues. And the time is changing for that. It's time to recognize that access to healthcare, that access to abortion, that access to contraception, these are civil rights issues, and these are issues that we must pour our resources in because they have a profound impact on the quality of lives of communities of color. We're currently waiting for several critical decisions to be handed down from the Supreme Court, including a case involving the rights of LGBTQ workers and a case involving the constitutional access to abortion in the state of Louisiana. And in those briefs, we include a lot of statistical and factual information to really paint for the court what the reality is for communities of color that are being impacted by these regressive laws. Practicing intersectionality in our daily work requires intentionality. It requires basing our work in history, thinking about how different rights are connected, how different systems operate to oppress and marginalize communities, and how historically marginalized communities are impacted by specific laws and policies. It also requires that we proactively work on our own biases and blind spots. We all have them. By reaching beyond our comfort zone and working with people and communities that are different than us, and take the time to listen and learn from them. It requires practicing nuance, and it requires courage, quite frankly, to challenge mainstream narratives. And this section is for the students here in the room today. It's clear that there's no shortage of work to be done to secure true equality. And as we commemorate the centennial anniversary of the 19th Amendment, I encourage you to think critically and to challenge overly simplistic narratives that exclude the experience of marginalized communities. To the students here who are from underrepresented groups, we need you. We need you to be excellent, to speak up, and to use your privilege to lift others up behind you. Be intentional about creating space for others who have historically been left out of those conversations. Be a disruptor. Shift conversations. Shed your self-doubt. Someone will always doubt your ability and whether you've earned your spot at the table. And that's okay. Just continue being you and being excellent. At this moment, more than ever, with the demographics of our country changing rapidly, and with the increase that we're seeing in racism, xenophobia, homophobia, transphobia, we need courageous minds who can think outside of the box to tackle some of our most pressing issues in public health and beyond, to push this country forward, and to fulfill the principle of equal justice under law upon which our country was founded. By doing so, you will carry the legacy of Black women who risked their lives for the right to vote. Thank you. And we have about 6 minutes left, so if anyone has questions, happy to take them. Yes.
Thank you very much. I'm really lucky that when I go to vote here in the city where I live, the only thing I have to do is tell my name and my address, and I don't have to show any ID or anything like that. But on the cases that you're talking about in the city, the conditions that we see now through the country is your group will be doing a lot of work from the legal point of view. But my question is, from the other part of it, what the people have to do in those areas, is that so difficult to accomplish that with time they can be with organizers in those areas, meet the requirements, even if you're not, in case you're not successful on getting rid of that particular discriminative law?
So we are a national organization, right? And the difficulty in being a national organization across the various issues that we work on is that we really have to work hard to develop relationships with groups on the ground. And for all of the issues that we work on, there are phenomenal groups on the ground doing really hard work to advocate for the communities that they serve, even within the restrictions that apply. And I think the same holds true for the voting rights work that we do. We operate a national hotline so that people can call in when they experience issues at the polls. And the system that we have volunteers that are on the ground that work with community organizations to quickly address those issues. Some of the restrictions that we're seeing, for example, so you mentioned here you don't have to show ID. Some states have tried to pass laws where they are requiring ID. And that presents an issue for different communities, for LGBTQ people, for people of color who are less likely to have state IDs or driver's licenses, for example. Other states are passing legislation requiring an exact match of their information with whatever is in state or federal databases. If there's a space or an extra hyphen, that might make them ineligible to vote. In other states, we're seeing poll sites in communities of color being closed and being moved to much further locations, or being moved to locations where you may not want to go, maybe close to a police precinct, for example. So there are a lot of different barriers. And while I think that any initiative has to be multi-pronged, right? It has to be a combination of litigation, but as I mentioned, litigation is never the end-all be-all. There's a bill that was introduced, H.R. 1, that is designed to address the Shelby County holding and to prohibit a lot of these discriminatory voting practices. But similar to a lot of the bills that Dr. Levine mentioned, it's not going anywhere. So we're going to continue pushing for legislative reform. Hi.
Hello. Thank you so much for the talk. I really appreciated it.
Sure.
I wanted to ask about just kind of this context, focusing on the South. I think a lot of times when we have these conversations, we typically point out southern states, and we tend to kind of skim over the systemic trauma in a lot of the northern states that still exists now. And so a lot of conversations I hear is just like, oh, well, you know, we're kind of okay, so what can we do to address the southern states and the red states? So what would you say to more progressive places like Massachusetts who still have this systemic trauma when it comes to voting in terms of things we can do?
I think that's a great question. And as I mentioned in the beginning of my talk, I was born and raised here. There's a reason that I left after high school. And there are still a lot of issues to systemic discrimination. It permeates every single system, right? And the importance is to be aware of that and to actively address to remedy those issues. So for more progressive states, I mean, I think New York is a good example. We have litigation in New York because they were purging voters from their polls. And no, I don't think any city or state is immune, even the ones that are self-professed more progressive. And so within states like New York, Boston, Massachusetts, I know that there is a strong community of activists, advocates who are pushing their cities and states to do better. So I would encourage, for those of you who plan to work in cities like Boston, New York, cities in California, there's still work to be done in those cities. Find a way to do good and use your talents for good. Any other questions? Good. Thank you.